Hey guys, welcome to Thrive Bites Podcast. I'm your host, Dr. Colin Zhu, and thank you so much for listening on. You could have been anywhere in the world and you decided to spend just a few moments of your precious time, and we greatly appreciate it. Here on the podcast, we talk about three things: living a plant-powered lifestyle, enhancing emotional resilience, and creating a thriving mindset. And I interview a range of passionate guests such as physicians, dietitians, coaches, entrepreneurs, and many more. And please join me as I deliver these engaging, informative, and high-valued conversations for you. And just remember, the first 5 seasons of the Thrive Bites podcast can now be found in the Chef Doc app, available in your Apple Store and Google Play stores. So what are you waiting for? Come on inside. Hey guys, welcome to another episode of Thrive Bites Podcast. I'm your host, Dr. Colin Zhu, and we have a wonderful episode with Dr. Sanda Moldovan, and she is a holistic biological dentist, and she is on a mission to change the face of traditional dentistry. We talk a lot about the different things in terms of what we put in our mouths, how to take care of our oral health. We debunk common myths. And what are some common things that we put in our mouths, right? Is fluoride safe? Is having mercury filling safe, right? These are different questions that we're going to answer in this episode. So you don't want to miss this, and we will see you inside. Okay, guys. Well, welcome to another episode of the Thrive Bites Podcast. I'm your host, Dr. Colin Zhu, and thank you so much for coming in. You could have been anywhere in the world, and you decided to spend your precious moments with us, and we greatly appreciate it. Today, we have a wonderful, wonderful guest. I have the amazing, amazing Dr. Sanda Moldovan. She is a visionary. She's a trailblazer, world of health and wellness. She's a double board certified periodontist and a seasoned nutritionist, and she has basically taken the field by storm. And her overall journey, which we're going to get into, is her unwavering commitment to natural oral health and for overall well-being. And she's not just a dentist, she's a game changer. She's the proud owner of the prestigious Beverly Hills Health and Dental Wellness, and it is a haven for those seeking the very best in biological dentistry across multiple locations in Southern California. And she's also the founder of Orasana, a natural product line for oral health focused on nourishing the mouth and detoxification. We can take all day to talk about her resume, but without further ado, please welcome Dr. Sanda. Hello.
Hi, Colin. So nice to be with you today.
Thank you so much for coming on to the show. Are you calling from sunny Southern California?
Yes, exactly. Cloudy, sunny California looks like right now.
You know what? At the time of the recording, we've been having a couple weeks of rain, and very, very atypical. Seems like we're in Seattle as opposed to, Southern California, which is good, but also there's no flood. There's no like sewer system that's like, a good infrastructure for everything is flooded. So, I guess we need to break out our kayaks, right?
Yeah.
Dr. Sanda, thank you so much for coming on. I know that you're a very busy woman and you do so much, but what's really nice about you, I've had the great pleasure of meeting you in person, is that you really, 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 really do care about not just people's oral health, but their overall well-being and giving the patients the education awareness to understand this connection. Because like we talked about off camera, everything is just interdependent. Everything is interconnected. On this podcast, we've had many, many different types of experts and specialists, but at the core of it is that how do we connect and bring everything home?
Absolutely. And I always say the mouth is the gateway to your health. So it's so important to take care of it, to understand it, to not put toxins and chemicals inside of it because they do get absorbed. So I'm so happy to be here and really spread the news for, dental health and oral health naturally.
Awesome. So let's start with the superheroine story, the origin story of how you got from point A to point B. Can you share with us the moment or series of moments that really stick out to you that you decided, hey, I want to go on this crazy path of health, specifically dentistry, and start something for myself. Did you come from a long line of healthcare professions? Like what were those moments for you?
Nobody in my family was actually a dentist. I'm the first one, let alone a periodontist. But how I started with this is, especially on the path of holistic oral health, is a curiosity about my own health. I actually moved next to this raw foodist back in 2006. And he's like, oh yeah, you have to go plant-based and raw food is the best. It's the only thing for you. And I didn't know anything about it. I haven't even heard about raw food up until that point. So I said, okay, I'll give it a try, and I had my own health issues at the time, with, hypoglycemia, and I wanted more energy. So I said to her, do you have any science behind this? Is there any science behind raw food? So my first book on nutrition was actually Conscious Eating by Dr. Gabriel Cousens, who's an MD, PhD, Harvard trained. And for me, that was huge because I really needed that endorsement coming from a master's, and like really science-based. And as you know, there's so much science-based evidence to food that we don't learn about in school. We have to figure it out after the fact. So basically, that's how I started my journey into understanding that lifestyle, food, and nutrition matter. And then I started applying it. After I applied it to myself, I applied it to my patients. And I noticed that they're healing better. They have less pain and inflammation. The same surgery that I was doing, prescribing drugs for people to alleviate pain, now I'm doing the same surgery on people that I'm putting on a nutrition program and supplementation to decrease inflammation, and they don't need the medication. So it really helped me realize, the power of food and the role it plays in oral health, whether it's surgery, whether it's periodontal health. So it's been a journey since 2006 and ongoing.
How long into your career did you implement these different layers of education for your patients? Did you, I guess, in a way, practice? How many years traditionally or conventionally did you practice before you're like, okay, let me add these layers because I'm missing something?
Luckily for me, it wasn't very long into my career. I finished dental school in 2001, and then I went to periodontal residency until 2004. So I was practicing for a couple of years before I moved next to this neighbor, the raw foodist. But it was really a start of discovery. So I went to the Institute of Functional Medicine. That was new for me. And in the Institute of Functional Medicine, they actually had presenters, MDs, talking about cases, their patient journeys. And I still remember sitting there in one of the lectures. This was probably around 2007, 2008. And they said, well, this patient had cavitations. And it wasn't until I treated the cavitations that the patient actually started healing from their gut health, gut issues. And I'm like, what in the world are cavitations? And he was showing like jaw bones and inflammation inside the jaw. And here I am, I finished a surgical residency at UCLA, and nobody's ever mentioned that word to me. And I was completely baffled. How is this possible? So, I finally understood that, cavitations are microbes. And that's when the journey started into, okay, who can I learn from about cavitation? So I ended up traveling to Switzerland to really learn from one of the biological dentists over there. What are cavitations? How do we treat them properly? Because, we, as you know, we have to go search for answers that we need.
Yes, for sure. For sure. It's similar to when we talked offline about the medical school arena as well as residency. We're not taught in comparison to pathophysiology, which is understanding the manifestation of disease process, or pharmacology, which is basically understanding how drugs work. We weren't really taught self-care, diet, nutrition, lifestyle, any of that is coalescing to a more proactive and preventative track. And so I don't know anything about dentistry, but I have, just a superficial awareness that conventionally, traditional dentists don't have a clue what you just said. And you, having gone through that same route, was baffled. You used the words baffled, right? So
Yes.
what is it about, what is it about conventional dentistry that you feel, why were these pieces missing? Is it because some courses were more important to emphasize in general? There was not enough funding, not enough, smart, brilliant people. Like why do you feel that is? And does this apply to most dental schools?
I really feel, it's like, treating the whole elephant. Everybody zooms into their own little small piece. So for dentistry, I think dentists started really zooming in the mouth. And they're looking at, okay, well, there's a hole in the tooth. How can we fill it? What's the best material? What's the best bonding? The chewing surface, this and that. And dental school treats a lot of the, teeth, but it doesn't really zoom out to look at the whole and the impact that dentistry has on the body in terms of toxicity and, the effect that microbes have on the whole. And I like to say they're treating the whole, not the whole. And I think it's
I like that.
yeah.
They're not treating the whole with a W, treating the whole without the W. Just
Exactly.
in case you guys didn't get that, all right?
Right. And I think it's really because we're all zoomed into scientifically what makes the best sense, what's the best material, what's the best technique, and we're really learning techniques, and it gives you just a kind of a broad understanding of little nuances in dentistry. When I went to residency school in periodontics, now we started to talk more about systemic health, more looking at cardiovascular disease, stroke, and relationship with periodontal disease. We're talking about the risk of pregnancy in people that have, periodontitis. So we definitely started as residents looking more at the systemic effect of oral health. But when it comes to cavitations, why that's missed, I think it's the lack of evidence that, at least when I went to residency 20 years ago, it wasn't there. It was more an anecdotal thing. And a lot of my instructors didn't even hear what is cavitation. They have no clue what it is. There was holistic dentistry for the longest time, at least even when I was a resident as well. They were kind of really looked down upon as doing dentistry without evidence, like they were just woo-woo things, but that's not true at all. As holistic dentists, we use a lot of high-end technology and scientifically based treatments that help to target, let's say, the microbiome, the toxicity of mercury fillings, the inflammation caused by cavitations. So we're really looking at how things in the mouth really affect the body by testing. So it's a personalized type of dentistry. And what can we do to reverse some of the signs of inflammation and toxicity that we're seeing from the mouth?
Yeah, so I think common things that come to mind. So let's just say, we're trying to bridge the gap from oral health to systemic health, right? And natural things that pop up for me are the use of fluoride in toothpaste, right? Or the use of mercury fillings, which to me sounds like it's more of a antiquated, old-fashioned type of procedure back in the day. And nowadays, you don't necessarily do that. And correct me if I'm wrong. And cavitations is, for me, relatively, newer. So can you go a little bit brief into why these are, quote unquote, more problematic and how that affects our systemic health?
Definitely. So let's take, for example, the first thing, the use of fluoride that you mentioned. We have studies to show that actually an increased level of fluoride affects the IQ. Studies done on children between ages fifth and eighth graders, that it lowers the IQ significantly. So having it in water is not the best solution. A lot of countries in Europe actually have banned fluoride in the water Yet we still have it as an add-on in a lot of the cities. Some cities have already decided we don't want fluoride in our water. And there's a great documentary, by the way, called Fluoride Gate that actually talks about how fluoride ended up in the water as an agricultural byproduct, essentially. So, and there's better things today to mineralize teeth and keep the teeth healthy than fluoride, such as, calcium hydroxyapatite, which is, a supplement is made out of the same structure that teeth are made out of, and actually applied topically can help to mineralize teeth. And fluoride causes toxicity. We see it on teeth and in bones. If there's too much fluoride, it actually weakens teeth and weakens bone. It has the opposite effect called fluorosis.
Kind of like how we're encouraged to drink dairy from cows, right, to promote more enhancement of calcium absorption. When there's plenty of studies, and if you look at the physiology, that's not actually true, because when you're drinking cow's milk, it produces a lot of acidic components, which you need a mineral like calcium to be able to, combine it in a natural way to be able to, process and metabolize it correctly. So what ends up happening is that you're actually leaching calcium from your bones. And there's actually plenty of studies to show that you're increasing rates of osteoporosis. Anyway, I digress. Go ahead.
No, you're right. Dark leafy greens. That's where the calcium's at.
Yeah, beans, tofu. I mean, what do we know? Go ahead.
Exactly. There was a second part to your question about mercury fillings. Sadly enough, in this country, there's a large number of mercury fillings being placed, not at our office. We're mercury safe. What's wrong with mercury? And people are saying, oh, I don't have mercury in my mouth. Well, if you have any silver in your mouth, and how do you know? You just open wide, look in the mirror. If you see anything silver on the surface of the teeth, most likely those fillings are 50% mercury. And the problem with it is if you drink hot soup or you're having your hot coffee in the morning, mercury vapors get released from the surface of that filling continuously. Unfortunately, this happened to me. I had 16 large mercury fillings in my mouth growing up in Romania, which made me toxic. And I didn't even know it, because at the time, I didn't know anything about toxicity. I figured you go to the dentist, they put something in your mouth, it must be healthy, right? Who thinks that you go to the dentist to make you toxic? Fast forward, I decided when I was right after dental school, I don't like these mercury fillings. They don't look nice. When I open my mouth, you can see metal, and I had them removed unsafely, unfortunately for me. So I started developing headaches, blurry vision, and I didn't understand what was happening. It was probably around 2006 that, this happened to me, right around the time that I was finding out about the holistic health. So one of the naturopaths, I was mentioning the symptoms, and she said, well, let's test you for mercury toxicity. I'm like, oh, okay. So we did a urine challenge test, and my mercury was off the charts, sadly. So I had to go through a process of detoxification. I definitely felt better, but, for those listening that have done chelation therapy to take out heavy metals, it's a very involved process, and it can make you very sick. And it takes months. It's not something that happens in 1 or 2 sessions.
So my question to that is, my first question is, does brushing trigger that same vaporization process? Or is it only high heat if you have mercury? Or does the physical brushing can also vaporize it as well?
Physical brushing can also vaporize it as well as, let's say, if you go to a hygienist and they use those Profi cups, to polish the teeth, to get the mercury filling shiny, that releases mercury particles as well. There's a great video on IAOMT, which is the International Association of Oral Medicine and Toxicology. It's called the Smoking Tooth video. And basically they were able to put a filter in front of a tooth that was removed from someone's mouth with a mercury filling, and it undergoes different simulations such as, rubbing, hot, all these, and you can see the smoke coming off the mercury filling.
Hey guys, what's going on? This is Dr. Colin Zhu, and thank you so much for hopping on to this week's episode. Guys, it's 2024. What is your intention for this year? Who do you want to become and how do you want to feel? Some of the things that you might be, looking to do is to lose weight. Some of you guys want to get out of your family history and genetics and not play victim to your medical and health destiny. Well, I'm here to tell you that it's very, very important to kind of look at some facts and figures. For weight loss, 71% of Americans are overweight and 40% are considered and classified as obese. And these numbers are continuously rising. A lot of these are associated with a lot of medical issues, arthritis, gallstone issues, heart disease, cholesterol, diabetes, cancer, and the list goes on. And also having and carrying extra weight increases your risk for COVID. Also, in terms of chronic disease, 60% of Americans carry one chronic disease, 40% two or more. Whenever I get a patient, it's usually a laundry list of medications that they are taking at the same time. Guys, if you are looking for a different and alternative solution, I've created a solution for you guys, and that's in the form of group coaching. If you want to be coached by us, Dr. Zoo, and our team members, me and my team, I've set up a beautiful 12-week, 3-month program that's going to be led by your own respective group coach, also led by me teaching you expert classes, and we teach you on what to eat, how to shop, what recipes to go for, where to navigate the supermarket, your pantry, your kitchen, and learning all about sustainable strategies on losing weight and preventing chronic disease. So if you want to learn more, click on the link below, and we would love to set up a breakthrough call with you guys to see if we are a mutual fit. And I want to be able to cheerlead and advocate you guys and be a support for your wellness journey. So click on the link, schedule a call. We'll see you guys on the next one and enjoy the rest of this episode. Oh, wow. Okay. Yeah. So can you briefly explain how can you safely remove mercury as opposed to, you go to a traditionalist and they may not know, is there a protocol to safely remove is a better way of reframing this question?
Yes, there is a protocol. And why is that? When we cut in a mercury filling with a rotary burr, we produce a lot of heat. And that causes a lot of vapor of mercury to rise in the air. So as you're sitting there with your mouth open, this vapor is coming right under the patient's nose and it goes right in their body, which is what happened to me. And not only that, but it goes through the mask of the dentist and the assistant sitting right there. And mercury toxicity is actually a common toxicity in the dental field. IAOMT Association has a smart or mercury safe removal technique that's scientifically based that protects the patient as well as the dental assistant and the dentist from inhaling the mercury vapor. The EPA does not allow any mercury vapor basically in the atmosphere because it's toxic. However, in a dentist office, when we cut into a filling, the mercury in the atmosphere is 2,000 times higher than the EPA allows. Yet, tons of mercury fillings are being removed daily without protection. So, what happens to this mercury vapor, which is odorless, you can't smell it, you can't see it, it enters the body and it settles into fatty tissues because our body's smart. It sees it in the bloodstream and go, oh my God, we got to do something with this. You can't let it circulate to the brain because it creates really headaches and blurry vision, and it's not good. So it stuffs it away in fatty tissue.
Yeah, it's a neurotoxin. Yeah. From the conventional medical world, our only counseling with mercury is only with pregnant women. And we say, hey, let's decrease your amount of seafood and sushi intake because of mercury, with these large fishes, right? Which is true, but we don't actually inspect what's directly in our mouths, right? Whenever I counsel, that's part of my history taking, actually. I ask them, do you have any type of mercury fillings? And if they do, I actually direct them to a smart mercury safe protocol dentist in their local area to safely remove it, because unfortunately, we live in a very toxic world, and we are unaware, and we don't really have a structure in place to be able to, like we talk about, inspect all the things we need to inspect. There's actually so many things that are passed through,
Yeah.
through the EPA, unfortunately. And over time, it's very hard to even tease out what each individual new component does to the individual health, because that's almost near impossible because there's so many, right?
Mhm.
And
Exactly.
yeah, so it's very thank you for sharing that. I think the listeners definitely need to understand, especially number one, if they have this type of issue.
Yeah, and you brought up a good point. I think it's so important for healthcare practitioners, if anybody's listening, whether you're a health coach, whether you're MD, ND, acupuncturist, nutritionist, to inform patients, educate, and really have a better collaboration. Know who your biological dentists are in the community, and reach out to them. And I do feel if we had a better collaboration between, the rest of the body therapists and the, the dentists, we could get patients healthier faster.
Yeah. And the third concept or the third topic is the cavitation, right? So, what is that? The natural thing that makes me think of is I think of a hole, right? You had mentioned, I think of a hole. When you said hole, you said I was thinking of missing tooth, right? But does it go deeper than that? Please explain.
Yes, absolutely. And a lot of people are saying, what is a cavitation? Is that a hole in the tooth? Well, cavity is the hole in the tooth, but the cavitation is a hole in the jawbone. And how does that even get there? Let's say a most common site is people that have had wisdom teeth removed. And I still remember being in residency, and we have to get rotations through the oral surgery department. And basically, they were priding themselves on how fast they can extract a wisdom tooth. Like the shortest amount of time was basically the winner. Yeah, all good. But the problem is, if you're just extracting a tooth and you're not cleaning the site properly, and now we can be left with an infected site, a site with bacteria, periodontal ligament. And oftentimes, after a wisdom teeth or a regular tooth is removed, they give you a gauze. Okay, bite down on this. When the bleeding stops, go ahead. You're ready to go. What's the issue with that? In the mouth, we have over 600 types of species of bacteria and trillions of microbes. So they see a hole, like, oh, let's go in and settle in as
Party.
well.
It's a pool party. It's a pool party.
Exactly right. So we believe that during the process of healing, if the gum is left open, microbes from the mouth enter inside, and a lot of oral bacteria doesn't need oxygen to survive because it lives under the gum as it is. So it can form a home there. Some of it has such a character that basically it can hides itself from our immune system, such as Porphyromonas gingivalis, which is a common, a pathogen in the mouth. It becomes invisible to our immune system. So it can live there very well without being detected. Our immune system is good, but it's not perfect. So in this cavitation area, we have bacteria that's breeding, and the body a lot of times kind of engulfs it into a, cyst. The bone gets necrosed. So we oftentimes find like mushy bone or black bone that's in there that we have to clean up. But interestingly enough, some people have symptoms, such as, I have patients say, oh, you know what, I have some tightening in my jaw. I feel like my throat is swollen. Some people actually have chronic fatigue. Some people have no symptoms at all, but they don't feel well. So usually I work with physicians, integrative physicians, and healthcare practitioners that refer patients to me who have chronic fatigue, brain fog, or really strange inflammation in their body that they can't figure out where it's coming from.
As you're saying this, I'm kind of feeling my jaw right now. No, I think it's very important because as a healthcare practitioner, no matter who you are, I think it's good practice to not miss anything. right? And we live in a system where there's a specialist for everything. And I like to use car analogies for whenever I'm educating my patients. And I say, just imagine a system where you have a mechanic. Instead of having a mechanic for your entire car, you have a mechanic for just the wheel, one wheel, not all four wheels, just one wheel. You have a mechanic for only the left headlight, and you only have a mechanic that only is focusing on the windshield wipers. And guess what? They don't really talk to one another that much, right? That's basically what our system is. And, there's pros and cons because we have brilliant people, right? We have experts, we have really, really brilliant people, right? But like we were also talking about offline, is that physical health, emotional health, mental health, they're all intertwined because they all live under one body, right? They're all within you, right? And it's the same thing. It makes perfect sense to what you're saying in terms of the oral health. Why wouldn't it affect everything else? Why wouldn't you consider everything, right? To have these pieces of education that's been missing is very mind-blowing, right? But then again, I came from something similar as well.
Yes. Yeah, I'm very passionate about it. And the more, I find out and collaborate with, people like you and other colleagues in integrative medicine, it just, we can treat our patients better.
Yeah. My next question is that what are some common complaints or questions or myths that you have to debunk now that you've over time have become a different type of dentist? What are some common myths that you had to debunk over time? Give me like top 2 or 3.
Yeah, the top one I would say has to do with the oral microbiome. Kill everything. You want to have a healthy mouth? Great. You got to scrape off all the plaque really, really well until you get your mouth sterile. That couldn't be farther from the truth. Yes, oral hygiene is important, but we need to have good biofilm. A friendly biofilm or friendly bacteria that's surrounding the teeth, the gums, the cheeks, the tongue is actually protective. We cannot live without bacteria in our mouth. We need to actually nurture the friendly and healthy bacteria in our mouth so we don't develop ulcers, so we don't develop cavities, and we don't develop periodontal disease. So I think that's one of the biggest things I want to, relate to the listeners is that don't just go there and buy, the biggest, the strongest antiseptic toothpaste. I've actually had patients that had a reaction to, let's say, strong fluoride toothpaste because it's toxic and it's killing too many microbes. Or like mouthwashes, for example, using Listerine can have a very, very strong negative impact on oral health. Why? Number one, because it has alcohol, and alcohol can transform cells and actually even trigger cancerous cells to form.
What about mouthwash that has hydrogen peroxide or some dilution percentage of hydrogen peroxide?
Depends on the dilution. Some people actually take straight up hydrogen peroxide, which I think is too much. It's killing too much of the microbiome. But I know there are some brands out there that have some dilution of hydrogen peroxide, which is beneficial if somebody has let's say, bleeding gums or an issue or like healing. I'm not a big fan of mouthwashes in general unless we need them for a certain amount of time. If our mouth is in balance, we really don't need mouthwashes except, maybe to give you a certain flavor.
Okay.
Yeah. I prefer chewable probiotics. I'm a huge fan of chewable probiotic and, maintaining a healthy microbiome. And in the last few years, there's been a huge shift into nurturing the oral microbiome. We have probiotics formulations that help with reducing cavities, reducing inflammation. There was actually a study from the Mayo Clinic. They actually looked at a certain Lactobacillus rhamnosus, and they found that women with a higher level of Lactobacillus rhamnosus have higher bone density levels. So I think it's amazing. We don't even understand fully, the capabilities of probiotics and how they really help communicate to our genes to have, to be beneficial to our health.
What about tongue scraping?
I'm a big fan of tongue scraping, highly recommended, especially because 60% of bacteria in the mouth can be right in between those little crevices of the tongue. So a lot of people's like, well, how do I know I need a tongue scrape? Well, go stick your tongue out, look in the mirror. If your tongue is coated white, and believe it, I encourage people to check in with your mouth every so often, periodically. Kind of look at your tongue, look at your cheeks. If you see anything abnormal, just practice self-care, oral self-care. But if the tongue is coated or brown or hairy, we call it a hairy tongue, where we actually have those extensions. Those are dead skin cells, pretty much. So actually scraping the tongues is like scraping a callus off the tongue. You can taste food better because we have a lot of taste buds also on the tongue, have fresher breath, and also helps to keep a healthy microbiome. So the tongue should be nice and pink. Don't use mouthwashes. And by the way, I forgot to mention that, with the use of mouthwashes can also kill the beneficial bacteria, to where there was a study done on mouthwashes, and people that were chronic users of mouthwashes had higher increase in blood pressure. So that's another reason not to use mouthwashes.
I'm going to have to revisit my mouthwash then.
Okay, sounds good.
I found a good one. I thought it was good. I guess I would have to run it by you later on. So. But I think it's really important to understand it. It's very important to kind of revisit certain concepts, because if you let too much time lapse without revisiting, without updating the science, without, just pretty much updating and revisiting, you're going to miss something. Right. So I'm, really, really glad that, you're able to kind of like re-inform us. Right. So with that in mind, for the next question, how, what would you offer to the people that are listening to do differently? Right. So we all know that brushing twice, brushing after every meal, correct me if I'm wrong, is good. No such thing as overbrushing is, my understanding. Flossing, I guess, is, once or twice is good. Right. So what are some things that you would recommend?
Yeah, I have really 3 steps for optimum oral health that are evidence-based today. Brushing, absolutely. I say small circles. You don't have to use a fancy electric brush. The manual brush works just fine. And using the right toothpaste or tooth powder. There's a lot of great tooth powders out there. I'm a big fan of anything, a toothpaste or tooth powder with calcium hydroxyapatite that helps to keep the enamel strong. Secondly, when we're talking about flossing, and this is another thing that actually the science that we have today shows that water flossing is more effective in reducing inflammation and controlling plaque than string floss. And as a matter of fact, what's that?
Why is that?
Well, we believe because, the water flossing is a pulsating water jet. And we've had studies done at USC to show at the Center for Oral Biofilms, 3-second pulsation with the water jet removes 99.9% of plaque on the teeth. String floss, people don't use it correctly. They just go in quickly, let me floss. But you really, to do it correctly, you got to wrap it around like a C around each tooth, really, then wrap it around like a C the other way. And the amount of people that are actually doing that is like probably 1% or less. Water flossing is a lot easier to use. You just point and shoot, really. It's a lot easier, and it cleans instead of just in between on one angle. It really cleans 360 degrees.
Oh,
so I was recently speaking at European convention, and in Europe, they no longer recommend string floss. The number 1 recommendation is water flosser or the interdental or in between brushes. That's their number 1 recommendation based on the recent data that we have. Because I mean, when you look at it, string floss was invented in like 1880s. So it's time for an upgrade.
Your Europeans, they always seem to be, it seems like they're always one step ahead. They ban everything and we're like, why? Right. And now it's not string, it's what they're like the Tesla version of, our practice, I guess.
Exactly.
So Dr. Sanda, thank you so much. I definitely want to close out, and I want, how can people find you? What are you working on? You do so much. You have your own podcasts, which is really, really cool. You speak at conferences and you have your own product line. What are some things that, you could offer to people that are listening? How do people find you? Please share.
Yeah. So, my mission is really to change the face of traditional dentistry as we know it, to motivate healthcare practitioners, dentists, hygienists to practice a healthier level of dentistry that's science-based. I'm encouraging everyone to look into biological dentistry if you don't know anything about it, or maybe this is the first time you're hearing about it. And I do that through many different ways. The Holistic Dentistry Show is a podcast in which we talk about a lot of the oral health topics or nutrition topics, such as Dr. Zoo's nutrition class. So we're on Instagram at Dr. Sanda. I have a line of natural oral care products, or Asana, and we can give your listener a special code and special gift for listening to this podcast.
Awesome. Thank you so much. And if people want to see you, you're in Southern California, right? I know you have multiple locations, but they're pretty much all situated there.
Yeah, I'm so grateful to work with 3 other biological dentists and a prosthodontist to help us deliver a higher level of care in dentistry. We are in Newport Beach, Beverly Hills, and Encino. And definitely anybody in these areas, come visit us.
Awesome. And we'll make sure we put all those references in the show notes when it airs. Dr. Sanda, thank you so much for coming on to the show. Keep up the great work. And yes, I can't wait to, I think it is changing face, right? The face of, traditional, but at the same time, we need to put the good word, out there. So keep up the good work. Thank you so much for spending the time to be with us today.
Thank you for having me.
Guys, thank you so much for watching another episode. If you like this, please like, comment, and subscribe. And if you feel that this was a benefit for someone else, please let them know. Until next time, please say goodbye to Dr. Sanda. Bye.
Bye.
Hey guys, we hope you enjoy that episode. If you like that, please like, comment, and subscribe. And please follow us on Apple Podcasts, Spotify Podcasts, and anywhere that you listen to your podcasts. And if you felt that this was a benefit for someone else, please let them know. And also remember that the first 5 seasons, 150 episodes, now can be seen and heard on our new The Chef Doc app. And don't forget to give us a 5-star rating, and we greatly appreciate it. And we'll see you on the next one.